Thank you for joining us this afternoon. I'm Jennifer Whiteside, BC's Minister of Education, and I am here on the traditional territory of the Musqueam, Squamish, and Tsleil-Waututh people. And with me is Dr. Réka Gustafson, BC's Deputy Provincial Health Officer. We're here this afternoon to answer questions about recent notifications regarding the UK variant of COVID-19 in schools in the Fraser Health region. I do want to say that the health and safety of staff and students is our highest priority. And we know that this news was not the news that parents and families, students and staff wanted to receive over the weekend. And one can understand the anxiety and concern about COVID-19 and its variants. In close collaboration with the Provincial Health Office, local health authorities, our Education Steering Committee and school districts are taking the necessary steps through our K-12 health and safety guidelines to keep schools safe for students and staff. I want to tell you a bit about what transpired over the course of the weekend. We became aware of variants of concern in 1 Delta school and 6 Surrey schools in the Surrey School District over the weekend. I can tell you that the Ministry has been in close contact throughout the weekend with the district, and the district, of course, has been working very closely with Fraser Health to identify close contacts and possible exposures. The Surrey School District responded quickly and ensured their school community was kept well informed, and I really want to commend them for their quick response. We know also that the Fraser Health Authority is working closely with Surrey and Delta school districts, identifying cases and close contacts for testing or self-isolation. There was rapid testing done yesterday, and testing is underway again today as we move quickly to assess and monitor potential exposures. Cases in schools mirror what is happening in our communities. So it was always a possibility that we would see variant exposures in schools. And as we learned from the first case of a variant in our schools at Garibaldi School a few weeks ago, there was 1 case identified, but 0 transmissions after testing. 0 transmissions to anyone in that school community. And what that says to us is that our health and safety protocols are working. When they're adhered to, when everybody is doing what they all need to do under our health and safety guidelines, we will see exposures, but very little in the way of transmission. 35 Surrey School District staff were tested yesterday, and all of those tests were negative. COVID is a global pandemic, a worldwide challenge, and with the guidance of our provincial health officer, our local health authorities, we are navigating the situation as safely as we can. I'd like to turn it over to Dr. Gustafson for a moment to just provide a bit more detail with respect to the testing that's happening right now.
Thank you very much. My name is Réka Gustafson. I'm a Deputy Provincial Health Officer in British Columbia. And I'm here to give a little bit more detail about the recent detections of COVID-19 in Surrey schools that were identified as variants of concern. In British Columbia, one of our most important tools for managing COVID-19 has been testing. If you recall, we had a test available in British Columbia as early as January of 2020. And we have been using these technologies and developing these technologies as we are learning more about COVID-19 and incorporating them into our follow-up. One of the things that we also have available in British Columbia is whole genome sequencing, which is the technique that we have used for some time to identify variants of concern. Whole genome sequencing is quite resource intensive. It takes quite some time. So one of the changes that we have made recently is to switch to a different technology that allows us to screen samples for the variants of concern. That meant that recently, about 3 weeks ago, we were able to go from testing about 20% of our samples for variants to 70% of our samples for variants. That occurred a little over 3 weeks ago. The results of this increase in screening means that there was an increased number of detections of variants. And those detections were reported in the past week, and Fraser Health with the Surrey School District responded to those detections. What's important for you to know is that the actual cases occurred for a little over 3 weeks, so they didn't all occur at the same time. Sometimes when we change our testing strategies or we change our screening strategies, we can have increased detections. And we will respond to those increased detections. And it is important for all of us to understand that while there may be some increase, and in fact there's an expected increase in the transmission of variants in our population, this increased set of detections was really an increased set of detections. And we absolutely must respond to them, and we will continue to respond to them. And since this new screening technology have been implemented throughout British Columbia, we may in fact see an increased number of identifications of variants. And so that's a little bit of context that I was hoping to provide in addition to Minister Whiteside's comments. Thank you.
Thank you very much, Dr. Gustafson. And I think we're ready for questions now.
Yes, thank you, Minister. As a reminder to everybody on the phone line, please press star 1 to enter the queue. You will be limited to 1 question and 1 follow-up only. I would also ask that you please take your phones off mute. You are not audible until your name is called. First question today is from Richard Zussman, Global News.
Minister, one of the things the BCTF is calling for is greater powers for the districts to put in district-by-district COVID measures based on transmission in different regions. Is this something the province is willing to consider rather than a province-wide universal approach to school-based measures?
Well, Richard, thanks for that question. And, again, I can appreciate the anxiety that everybody doing such an incredible job in our schools right now, keeping them open and keeping kids in schools, is experiencing as we see the pandemic develop. What I would say about this situation is that it's a little, we need to understand what happened in this particular situation. I think that it's very good news that the testing that has been done so far has indicated no transmission. And really what that tells us is that our safety plans are working. And I think that we need to make changes if we're going to make changes based on evidence. And at the moment, we need to let this process unfold and find out precisely what happened. I think before we have any information, enough information really to go on with respect to what happened.
Richard, do you have a follow-up?
I'm not sure if this is for Dr. Gustafson or for Minister Whiteside, but on testing, should there be a clear policy in place around if there is a variant exposure, that there is a certain testing protocol that's publicly known immediately kicks into place, rather than in Garibaldi we saw 80 some odd tests done in various classes. Here in this case, it seems like some teachers have been tested, but it seems inconsistent in terms of who is being tested. Is there thought being given, and should there be thought being given to a universal testing policy when there's a potential exposure linked to the variant?
Thank you for your question. I think what's really important to know that when we have a case that's identified in a school or in fact any other setting, there's actually a very careful investigation of that test, of that event. That's what case and contact management is. Local public health actually does a thorough investigation of each case. And based on that investigation, recommendations are made for testing. So it's actually not something that I would recommend we protocolize, because then we lose the benefit of the intelligence and that comes from a careful assessment of the case. The other thing to keep in mind with variants, the variants that we are looking at right now, is that at the moment, our understanding is that the mode of transmission is exactly the same as with any other COVID-19 variant. What we do know is that the virus is a bit more efficient at transmitting. So some of the investigations that are occurring right now are the consequence of the individual case assessment that is done in each school setting, and therefore testing is done as it is indicated by that investigation. And there's some enhanced testing done right now because these are some of the first identifications of variants in the school setting in British Columbia. We will learn from these. As we learned from Garibaldi, as we have learned from these, we will apply what we have learned to our testing strategy going forward. But I would not dismiss the importance of that individual assessment and a testing strategy that's based on that.
Thank you. Next question is from Katie DeRosa, Vancouver Sun.
Hi, Minister. Sort of a bit further to Richard's question is also the call for masks all the time at the desks, including for elementary school students. Would you consider that, given the presence of the variant, and especially given that teachers' concern with potentially being infected?
Well, thanks for that question, and I will ask Dr. Gustafson to address the technical aspects of mask utilization. But what I will say again is that we have very robust health and safety plans in place, and our experience has been that where our safety plans are adhered to, we see very low rates of transmission in schools. We've learned from Earl Marriott earlier in the year. We've learned from Garibaldi, as Dr. Gustafson said. We will learn from this situation. And I take to heart Superintendent Tinney's comments this morning with respect to encouraging a mask culture to develop at where I know that it has in very many schools, and that is very appropriate. And this, I thought the Surrey School District's notion of if you're moving, you're wearing a mask is a good way for kids to remember what they need to be doing, and of course staff need to be wearing their masks at all times when they're moving as well. So I think again that what we know is that when our safety plans are being adhered to, that the risks are low, and perhaps you can address the rest of the question.
Thank you for your question. And again, we have mask recommendations for schools that are based on our understanding of the transmission of COVID-19 virus. And I think that's important. In fact, we adjusted our mask recommendations after Christmas based on what we learned from investigation of individual cases. What's important is that an effective policy consists of what we know about the transmission, but also the ability for individuals to comply with that mandate, or that requirement or that recommendation. So we worked very, very closely with our public health colleagues as well as our educational colleagues to come up with a mask recommendation that meets all those requirements, addresses the situations in which transmission is possible, because the other layers of protection for some reason cannot be implemented in that moment, as well as the ability of individuals to comply with that policy consistently enough so that the overall policy is effective. So I would say that based on what we know about the new variants of COVID-19, I would not recommend a change in our masking recommendation. But as with everything else in this pandemic, we have continued to learn, we continue to review the evidence. At this moment, there's no indication for the change in that recommendation. Thank you.
Katie, do you have a follow-up?
Yes, please. Also for the minister, there's been reports among teachers that they're quite simply facing burnout. I mean, this is nothing new, but especially with all the stresses of the pandemic and this new variant. Like, what is the ministry doing to support teachers who just feel unsupported and who feel the stress of having to sort of basically enforce all these safety rules in the classroom while at the same time keeping themselves safe? Like, what would you say to teachers who are just burned out and struggling right now?
That is such an important question, and it is such an important issue, and that we are working with our education partners on with respect to really trying to build in some more supports for mental health of everybody who's in our schools right now. It's I am very aware that educators and staff in schools didn't expect to find themselves on the front lines of a pandemic. Of course, nobody did when we think back to where we were at this time last year. So we continue to, we have a health and safety working group of our provincial steering committee. That is one of the concerns that they are that they are working on. We work closely with the BCTF and our all of our education partners to try to develop better supports for teachers and everybody who is experiencing the stress of working on the front lines in a pandemic.
Next question is from Zara Premji, CBC.
Hi there, thank you. I think this question would actually probably go to both of you. What exactly is stopping school districts from going above and beyond provincial protocols? Because they say they cannot make changes unless you're going to do that at the provincial level. So could they step up measures like mask wearing in elementary schools if they deem it necessary without your direct mandate and approval?
Thanks for that question. And to clarify how our health and safety guidelines came into place, we worked very closely again with all of the people who work in across our schools, our administrators, trustees, parents, our the Indigenous rights holder partner groups with which we work last summer to develop the Safe Restart Plan, because we all understood and we all agreed that that providing maximizing in-class instruction for kids is absolutely critical, not only for the learning that kids receive at school, but for all of the other supports, whether it's meal programs or mental health supports that they receive through school. So that is a fundamental societal value, and it's a fundamental necessity to help us get through this pandemic. And that restart plan is supported by the guidelines developed by the provincial health officer with respect to how we can operate schools safely. We have taken that framework and applied it to written education guidelines that are consistent with what the provincial health officer has set out. And so, you know, it is not that we're operating on those guidelines. It's not the case that without direction from the provincial health officer, we would take a different tact, because the provincial we have relied on our public health leadership to guide us through this pandemic based on science and based on the evidence.
Zara, do you have a follow-up?
Yes, I do. So, Dr. Gustafson, big changes have been announced in Fraser Health about how they're now going to screen for the variants of concern and test people with no symptoms who are close contacts. Will these changes now be implemented across the province?
So thank you for the question. So not at this time. And again, what Fraser Health is doing right now is to respond to their current situation, learn from that. Whenever a region implements an approach, we actually speak every 3 times a week with each other. We make sure that we look at the data that are gathered from any new or local approach that's put in place, and we use those data to inform our standard approaches. So at the moment, again, the Fraser Health just announced an approach that is appropriate for them, for their local situation, and if data are produced from that activity, we will certainly look at that data. But again, there is no indication right now that in British Columbia we need to change our approach.
Next question is from Marcella Bernardo, News 1130. Marcella, are you there?
Sorry. Hi,
Okay,
Dr. Gustafson. Hi, I'm there. Hello. Hi. Can you hear me now?
Go ahead.
Hi, sorry. Dr. Gustafson, if you could just elaborate on why not let people get tested when they want to get tested. Last week you alluded that if somebody wants to get tested, they can just walk in and get tested. But we're hearing from many people who say that even though they've had contact with someone who's tested positive, they're still being advised, don't get tested.
So in British Columbia, we recommend testing for anybody with symptoms. So if somebody goes and says, I've been exposed to COVID-19, and they don't have any symptoms, then my clinical advice to them, and probably the advice of somebody, or public health advice, and probably the advice of anybody who understands disease transmission, would be that a test is not recommended because it's not going to change management. In all areas of medicine, We recommend a test if that test is going to change what you do. If you know you've been exposed to COVID-19 and you're a close contact, you're going to be asked to isolate at home for 14 days. A test on day 5, 6, 7, 8 isn't going to change that. And the other thing is that if you are being asked to self-isolate, and this is one of the concerns that we have actually, is that if you are being asked to self-isolate and then you get a test and that test is negative, we are actually quite concerned that people will misunderstand that and perhaps think that their isolation period is over, and it's absolutely not. So one of the things that our guidelines reflect is when will the test, negative or positive, actually give you useful piece of information in order to actually change what you're doing or change what your doctor will be doing for you. So the recommendation is not to be tested if you don't have symptoms, because it really doesn't change anything in how you should behave. There are certain situations where or certain jurisdictions that have incorporated testing into their contact management. We have not done so in British Columbia. We're still asking individuals to either self-monitor or self-isolate for 14 days after they've been exposed to COVID-19.
Marcella, do you have a follow-up?
I do. This is actually for both Minister Whiteside and Dr. Gustafson, because we're hearing from schools in Abbotsford where concerns about ventilation being bad led to them opening their windows, and now some of those windows have been closed or hammered shut, and that's a safety risk. So just checking to see with you what's being done now to ensure that if a teacher wants to open a window, they're not going to be restricted from doing that if they consider that a way to ventilate their classroom.
Thanks for that question, Marcella. I became aware of that situation over the weekend, and I can tell you that the ministry immediately reached out to the district to get information about what's happening with that situation. It's my understanding that there are some other safety issues related to the frames of those windows, and I've asked what we are doing around ensuring that those windows are safe and that teachers are able to open windows in that classroom, and I'm expecting to have information back soon on that question.
We have time for one more question this afternoon, and that comes from Shannon Patterson.
Hi, it's Dr. Gustafson. The only thing I would add to that is that good ventilation is part of the layers of protection that we have to prevent COVID-19 transmission. I would like to again return to the fact that the safety plans that we have in the schools in British Columbia have been extremely effective, and there's been very little transmission in schools. Again, we inform people when there is a case so that they are able to take precautions, and we can do follow-up. And absolutely, ventilation is part of the layers of protection. But I would also just like to say that in general, because those layers of protection are working, I do not see a specific concern about ventilation in schools. Thank you.
Okay, Shannon Patterson, CTV.
Oh, hi. First question is for Minister Whiteside. It's actually going right back to Richard's very first question, so I didn't feel like I got a clear answer. The BCTF is asking why can't individual districts be given the ability to ramp up their health and safety protocols if they're seeing problems like we're now seeing in Surrey. What Minister Whiteside said is you'd let this process unfold to find out what happened. Does that mean that this might be something that could be allowed, that there could be a scenario in which whatever the test results are would make you think that, yes, maybe districts should have the ability to individualize their plans?
What I'm saying is that what we have learned over the course of the pandemic has informed how we have updated our safety guidelines. For example, what we learned over the course of the fall and through Earl Marriott with respect to physical education classes, with respect to ensuring that that students and staff don't come to or are doing the self-assessment every morning and don't come to school ill. Those are as we learn from those, we have updated the safety guidelines to ensure that we're very explicit about those issues, and we do that in collaboration with and under the direction of the provincial health officer and in collaboration with all of our partners. So this situation is no different. We will learn from this situation, and if it is necessary to update the safety guidelines, that is a question that we are constantly looking at.
Shannon, do you have a follow-up?
Yeah, this is for a colleague, and it's for Dr. Gustafson. Can you tell us when we can expect to hear those who are 80 years old and above to hear about pre-registration for their vaccines? It's supposed to start in just a couple of weeks, but we haven't heard anything about how they're going to register. So will we learn something this week, next week?
So I'm actually not sure when the announcement is going to happen. We're certainly working on it, and we expect to be able to give you information in the next couple of weeks, but I don't have an exact date on that.
That's all the time we have this afternoon. Thank you for joining us.